My name is Diane. I'm a care consultant with Rosa, formerly known as Live Home. We do provide the in-home non-medical care to our clients. We too have been affected by COVID. People don't want, strangers in their home. They don't want the exposure to COVID. Again, we have people that are willing to take that chance because they know they need the care, and those that are refusing. The new trend that's coming up is they're going to ask if their caregivers have been vaccinated, and they're going to request only vaccinated caregivers. So that's a discussion that we're having with our caregivers is you may be looked over if you haven't been vaccinated, because we have clients that are only going to want to use vaccinated. So it's about the education and encouraging them to get vaccinated, but also dealing with the fact that some will refuse. So Live Home started in 1999, the year I moved to California and had my third child. It was founded by a gentleman named Steve Barlam, and he was a social worker. And so that he started the care management and caregiving services, the integrated model. He did a lot of education, a lot of CEU opportunities, and was all about that social work. Since then, the company built up. We had a care advocate program where they had advanced degrees, masters in social work, and they were the ones that did all our intakes. So what was nice is that anybody calling in was able to speak with someone who had that education and advanced knowledge of the process and the services that we provided. And then we have care managers and caregivers in each office. In the last couple of years, Arosa has purchased quite a few companies over across the nation. And so now we are all under one roof of the name Arosa. Arosa is a village in Switzerland where the CEO's family used to go back for family reunions, kind of that multi-generational theme, if you will. They have made it a provider of integrated care services throughout the nation now. So the other companies some were just caregiving, and now they have care management as well. It's a very team-based integrated model. The care managers they all have their masters in education, social work. Our care manager actually has his master's in clinical psychology. And he's able to work with the families. We've got, the family dynamics. We've got resistance to care. We have some family members that are here without family nearby. They all live out of state. And so the care manager can help oversee that and help with making sure that they have the resources. If they need a fiduciary, if they need to do a reverse mortgage, maybe they do need placement into a community. So the care manager can kind of help with that. He can also work with the physician and making sure that appointments are kept. And what's nice is he also oversees the caregivers. So say a caregiver meets with a client and they do not get along, and we know that happens. He can come in and kind of mediate that and explain that this is where the client's coming from and that they didn't mean what they said, or maybe the caregiver's just not the right fit. So the team will work together and make sure that we do have the right fit, the best that we can. We have locations now, California, Florida, Illinois, Massachusetts, New Jersey, North Carolina, where our CEO is, Nashville, Tennessee, and then in Houston. And good news is that our team in Houston survived the big freeze of 2021. Let's see here. And I know it says that we're the only home care provider that offers the integrated care management and caregiving services. There are other companies that say this and do that. Ours are certified, and we are members of ALCA. And so we have that extra education. And a lot of our caregivers and the care manager also can work with a lot of clients that have the dementia and memory deficit, if you will. Our mission is to attract, train, and retain treasure the best of our caregivers. So we're always working on making sure that we're hiring the best, doing the education, and it's proven challenging during the COVID, the pandemic, but we're making sure that our caregivers join our Zoom meetings and get to meet the staff. and feel like they're part of the team. Because I think when you know that you're part of a team, you feel like you belong and you're going to stay. You're not just another caregiver out there and you've never seen who your boss looks like, and what have you. And our values, you can see here, we're just trying to be ambitious while humble and grateful. Bottom line is caring for our clients, and caring for our caregivers. We're members of the SICA Foundation. We are part of the MS Society. We're part of Provisors, ALCA, the Aging Life Care Association, and then the Home Care Association of America. And then we also provide care for those who are over 18. We don't just provide care for those that are 65 and older. We provide care for those with MS and Parkinson's disease. We have a lot of experience with that. And then those with any physical disabilities and any mental health disabilities as well.